Hi, I'm Cassidy. I'm a nurse practitioner student at YSU, and today I'm going to be interviewing Haley. So I'm going to have you start by telling me about yourself.
So my name's Haley Newpert. I've been a nurse practitioner for 4 years. Before that, I was a nurse at Butler Health System, um, starting at the age of 20, I guess. I did telemetry nursing for about 5 years, and then I went over to the surgical CCU there and did open heart procedures as a nurse for another 3, 4 years while I finished school. And then I actually joined with a Butler cardiologist, and I'm his nurse practitioner that rounds in the hospital for him.
Okay. And then how would you describe your current APRN position and what specialty are you in?
So I do cardiology. I am the nurse practitioner at Jamison Hospital for him. So I round on all our patients who are admitted in the inpatient setting for any new diagnosis of chest pain, AFib, heart failure. I treat in the inpatient setting, order testing, um, admit, discharge on our own service, and also in consultation.
Do you see an APRN influence in today's healthcare system? If so, how? And if not, why?
I definitely see a very large influence from the mid levels at the hospital. They're actually starting to get them to be more independent. Where I'm at Jameson during NUPMC, they're starting to see patients independently of the provider with the hospital service. Trying to think how else really that they're influencing. It just seems like doctors are definitely starting to depend on them more, especially with, I feel like the patient acuity and the amount of them has definitely increased over the last several years.
And what are some of the barriers that you see APRNs face?
I think still a lot of maybe older patients, specifically, every time I walk into a room, may not necessarily take me seriously at first until they get to know you and get to know you as a provider. But also, I do have a lot of friends who are nurse practitioners or PAs, and depending on who they work for and how the doctor looks at mid levels, some of them are even treated just as a basic scribe. So I think that's definitely a obstacle that they're facing.
And then lastly, what are some changes that you would like to see made for APRNs?
Just definitely some more independence, I think would be great for APRNs. Um, Especially with the doctorate program becoming I guess prevalent now. There's a lot of doctorate programs. So I think more independence, especially with the growing healthcare industry, would be important.
Okay, well, that concludes our interview. I want to thank you so much
Yeah.
for your time.
Yeah, no problem. Thanks. Bye.